Now, in the fourth section of esophageal injury and infections, we'll be studying about the different types of esophageal tears and hematomas. There are two different types of esophageal tears that can occur. One is called as Mallory-Weiss syndrome, and the other is called as Boerhaave syndrome. In these tears, there's a laceration within the esophagus, which causes incentive bleeding throughout the esophagus, and when a person vomits, there's blood that contains within the vomitus. So in this section, we'll be studying about Mallory-Weiss syndrome, like I've mentioned before, Boerhaave syndrome, which is a more major type of tear as compared to Mallory-Weiss syndrome, and then spontaneous esophageal hematomas that occur within the muscularis of the esophagus. So Mallory-Weiss syndrome is a laceration of the gastric cardia due to forceful vomiting. It occurs when there's a shearing force on the gastroesophageal junction. There's a shearing force in the gastroesophageal junction and the proximal part of the cardia, which causes this part of the stomach and the junction to herniate through the diaphragm, and this occurs because of the increased intra-abdominal pressure within the abdomen, and this is mainly due to this forceful bouts of vomiting that occurs within an individual. These patients mostly have a hiatal hernia. Hiatal hernia is when the part of the stomach is being protruded out of the diaphragm and a hernia develops. The larger the hernia, the more distal is the laceration in the proximal part of the stomach. Other than that, we can see Mallory-Weiss syndrome in patients who are alcoholic or in patients who use aspirin on a regular basis. The forceful vomiting causes increased intra-abdominal pressure with symptoms such as forceful coughing. When the patient coughs very forcefully, it increases the intra-abdominal pressure, and this causes tear within the esophagus and laceration within the esophagus. Other than that, extreme straining can cause increased intra-abdominal pressure. Retching during endoscopy. Transesophageal echocardiography that I've mentioned before is a probe that is being transferred through the esophagus to visualize the heart. And other than that, cardiopulmonary resuscitation, as during during CPR, the patient, the doctor causes a very hard pushes on the chest wall of the patient, and this can also cause lacerations and perforations within the esophagus. So how would a patient present in the outpatient department? The patient might complain of hematomas. Hematomas, being more specific, is vomiting that consists blood, and other than that, melena. Melena is when blood is present within the stool. So the patient might present with these more specific symptoms. Other than that, if we evaluate the patient through an endoscope, we can see that there's at least one laceration visible within the esophagus. As you can see in this picture of an endoscope, there's this laceration or this tear within the esophagus, which causes the bleeding. Endoscopy is also used, not only used for diagnosis, but it is also used to rule out any other gastrointestinal lesions, such as erosive esophagitis, any sort of peptic ulcers, gastritis, Barrett's esophagus. All these gastric lesions can be ruled out with the help of endoscope, and a diagnosis of Mallory-Weiss syndrome can be confirmed. As the bleeding is very self-limiting, mostly the bleeding is self-limiting and it does not cause a very drastic effect, but it can be very massive sometimes. So the treatment is supportive if the patient has a very if the bleeding is of a self-limiting nature. Other than that, injections of epinephrine and polydocanol can be used to reduce the bleeding from the laceration or the tear. Endoscopic clip placement, an endoloop, and an endoscopic band ligation. These are therapeutic alternatives that can be offered to the patient. And if a patient presents with persistent bleeding, angiographic embolization through the left gastric artery is considered as a definitive treatment for patients with continuous bleeding. Now, Boerhaave syndrome. It is an extreme version of the esophageal tear as compared to the Mallory-Weiss syndrome, and it occurs in response to an increase in the intra-abdominal pressure and an increase in the intragastric and the intrathoracic pressure gradient. It is a more major form of the Mallory-Weiss syndrome, and it occurs when there's a transmural tear with perforation. The tear within the esophagus is through all the layers of the muscularis, and a perforation occurs. This causes heavy blood loss. The preceding symptoms that causes Boerhaave syndromes are such as severe vomiting and retching, which causes forceful vomiting effects. Other than that, abdominal straining, like we've mentioned in Mallory-Weiss syndrome. Blunt trauma can also cause this perforation, and severe coughing, which causes increase in the intra-abdominal pressure, can cause Boerhaave syndrome. In this picture, we can see there's a very major type of a tear within the esophagus if we see it through an endoscope, and this perforation causes blood to be accumulated within the esophagus, and when a patient vomits, the patient can see blood within the vomitus. The patient might also present with catastrophic symptoms such as sepsis and shock. But other than that, the other symptoms are severe chest pain, which can be usually confused with cardiac and pulmonary events. And that's why this can cause a delay in the diagnosis and treatment of the Boerhaave syndrome, as we can confuse it with cardiopulmonary catastrophic events. It can also be confused with dissecting aortic aneurysm, as the pain is mostly in the central chest and can radiate towards the back, and pancreatitis, which is more of an epigastric area. Boerhaave syndrome is diagnosed by subcutaneous emphysema with crepitus, if you hear with a stethoscope. Other than that, if you see through an X-ray, the radiographic findings can be seen that pneumomediastinum and a left pleural effusion can be seen. Surgical repair and drainage is a more definitive treatment for Boerhaave syndrome. Other than that, self-expandable plastic stent and chest drainage is also one of the treatment options. Now, if we talk about spontaneous esophageal hematoma, this is a very rare entity, and it occurs when the bleed occurs between the mucosa and the muscularis propria of the esophageal wall. There's a hematoma that occurs within the esophagus, and if it bursts, it might cause hematomas. So if we talk about the causes, excessive use of aspirin in patients such as rheumatoid arthritis, spontaneous esophageal hematoma can occur. Underlying coagulopathy or the use of anticoagulants, as anticoagulants are supposed to let the bleed to occur. So this can cause an excessive hematoma within the muscularis of the esophageal wall. An abrupt increase, a sudden increase in the intra-abdominal pressure or the intrathoracic pressure, which causes this hematoma to occur, which can be because of forceful vomiting, coughing or sneezing that is very abrupt and very sudden, any sort of foreign body ingestion. So if we talk about the specific treatments, A patient with spontaneous esophageal hematoma might present with the triad of symptoms, which would consist of retrosternal chest pain, dysphagia, and hematomas. Conservative treatment is the mainstay treatment, in which the patient is being hydrated through IV, and other than that, the patient is monitored that the patient is hemodynamically stable or not. And in this, the patient usually takes around several weeks to completely heal the mucosal surface. Other than that, there's always a delay. There's usually a delay within the diagnosis and the treatment of spontaneous esophageal hematoma, as it is being compared and is misdiagnosed as a cardiopulmonary event. So in the CT chest, what would we find regarding spontaneous esophageal hematoma is that the esophagus is very diffusely thickened, as in that there's a very specific appearance which is called as a double barrel appearance, and you'd see there's a obliteration, there's an obstruction of the esophageal lumen. And endoscopically, if we see the esophagus, we can see that there's the obliteration of the esophageal lumen. And if we see very clearly, there's a long, deep, friable blue submucosal mass, which is known as the hematoma within the mucosal surface. And it can be present with or without a very visible tear with the hematoma. So in this section, we studied about different types of tear. One is called as the Mallory-Weiss tear, which is a more minor form of tear, and it's mostly caused because of forceful vomiting, which causes laceration and tears within the esophagus. Another more extensive type of tear is called as the Boerhaave syndrome. And then we've studied about hematoma. There's a spontaneous esophageal hematoma that occurs within the muscularis of the esophagus, and we've studied about different treatment options regarding the hematoma. That's all from this section. Thank you for watching sqadia.com.